Excellencies, Heads of State and Government, Your Excellency Antonio Guterres, the UN Secretary General, Your Excellency Mahmoud Yusuf, the Chairperson of the African Union Commission, the Director of World Health Organization, Director CDC, distinguished leaders, partners, ladies and gentlemen. I bring you warm greetings from His Excellency Yoweri Kaguta Museveni, President of the Republic of Uganda, on whose behalf I am presenting this statement to you. Allow me to begin with a message of cautious optimism. Today marks 11 days since Uganda last recorded a confirmed Ebola case. To date, Uganda has registered 19 confirmed cases, of whom 7 have successfully recovered and have been discharged, while we sadly mourn the loss of 2 lives. Your Excellency, while these developments provide encouragement, we remain vigilant. Ebola is a disease that recognizes no borders, and no country can afford complacency. Our experience has repeatedly demonstrated that outbreaks in one country quickly become a concern for the entire region and indeed the entire continent. Excellencies, this meeting is both timely and important. We are gathered here because we share a common responsibility to protect our people and to collectively stop the spread of Ebola. The strength of our response will depend not only on what each nation does individually, but on how effectively we work together as a region and indeed as a continent. Uganda has activated a whole-of-government approach and a whole-of-society response guided by political leadership, community engagement, surveillance, contact tracing, infection prevention, and countermeasures and cross-border collaboration. However, sustained cases will require coordinated regional action. On behalf of the government of Uganda, therefore, I respectively call upon all African Union member states to strengthen our collective response through the following actions. First, all member states should institute and strengthen entry and exit screening measures at airports, points of entry, and land border crossings in accordance with the guidance of the World Health Organization and established international health regulations. Second, we should work towards a standardized regional public health locator system for departing and arriving travelers to facilitate timely tracing and follow-up where necessary. Third, we must promote transparency and a real-time sharing of epidemiological information. Timely exchange of data remains one of our most effective tools for preventing cross-border transmission and informing evidence-based decision-making. Fourthly, we should intensify coordinated resource mobilization, leveraging both domestic financing and support from development partners to ensure that response efforts are adequately funded and sustained. Fifth, while responding to Ebola, we must safeguard continuity of essential health services. Uganda has made significant progress in areas such as routine immunization, maternal and child health, malaria prevention, and primary health care services. We cannot allow an outbreak to reverse these gains. Our response must therefore protect both public health scrutiny and essential health service delivery. Sixth, we must sustain high-level political commitment across the continent. Strong leadership remains indispensable in mobilizing resources, maintaining public confidence, and ensuring accountability for outbreak response. In addition, Your Excellency, we should further strengthen cross-border collaboration in surveillance, laboratory systems, risk communication, and community engagement, emergency preparedness, and coordination mechanisms. Finally, we should establish and strengthen joint monitoring frameworks to regularly assess progress, identify challenges, and ensure that agreed actions are implemented expeditiously. Your Excellencies, the lesson from previous outbreaks in Uganda and indeed Africa is clear. When Africa acts together, Africa succeeds. The fight against Ebola is not the responsibility of one nation. It is a collective responsibility that demands solidarity, vigilance, and sustained commitment. And that's why at this point, I would like to thank Your Excellency for convening this meeting. It is indeed timely. Let us therefore reaffirm our shared determination to protect our populations, strengthen our health systems, and prevent the spread of Ebola across our continent. Uganda remains committed to working closely with all member states, the African Union, the Africa Center of Disease Control and Prevention, the World Health Organization, and all partners to achieve this goal. And in concluding, allow me to express concern on how some countries have treated Ugandans abroad. Uganda, although has had previous epidemics, we would like to state clearly that we have never exported any epidemic, never will we export in this current epidemic. We therefore call upon all countries that have imposed travel restrictions to Ugandans to lift them, because Uganda has effectively controlled Ebola in the current outbreak. Finally, Your Excellency, I would like also to state that together we can stop Ebola, together we can protect Africa. I thank you for your kind attention.